More than 66 million people have tested positive for COVID-19 globally, and over 1.5 million have died. That's according to the latest data from Johns Hopkins University. Let's talk about the current vaccine developments around the world, and we're joined now by the World Health Organization's spokesperson, Dr. Margaret Harris. Dr. Harris, evening. Good to have your time tonight. So, a lot of good news as far as vaccine development is concerned. Many countries now got the ball rolling. They're now going to roll out inoculations. Russia started today. The UK and Bahrain are due to start, I think, in the next few days. But there is still a great deal of skepticism about the vaccines. How should we be dealing with that?
Well, indeed, as you say, there's some very good news. Vaccination is beginning, but vaccination is only as good as getting it in people's arms. And also, we have to follow all the different vaccination all around the world, collect all the data, continue to collect the data, continue to assess what's working and what is not working, and make sure we continue to refine it. And most importantly, we have to, in every country, continue the public health measures that are bringing the virus numbers down, because we want to get the virus down as low as possible while we're building up this immune wall.
And just on data collection and scrutinizing the data, we've seen in the last few days on the back of the UK's announcement that it had ordered all of these doses from Pfizer and would start rolling out the inoculations from as early as next Monday. Dr. Fauci, for example, in the US, saying perhaps a lot more time should have been spent on scrutinizing the data independently. That was also echoed by some of the scientists in the EU. How worried are you about the WHO, about countries being so desperate to try and bring COVID-19 under control that they perhaps skip a few steps in making sense of the data where the vaccines are concerned?
Well, certainly not only reviewing the data now, but continuing to review the data is critical. But most of the regulators who are doing that now understand the process, and there are three things you want to look at with any vaccine. You want to look at, is it safe? Have you done the tests that indicate that it's not creating adverse reactions in the people you've tested it on? Secondly, does it work? Now, we've heard some good results. So we've seen that in the people who got the vaccine, they were much less likely to get infected. But we want to keep on following that, because we know it works now, but how long does it work for? And thirdly, are you manufacturing it at the highest safety and quality standards to ensure that there's nothing that gets into that vaccine that could cause problems? So those are the three things we all look at and will continue to look at. As for, did work corners cut, it's a very fast developed vaccine, but that's because there was a lot of sharing of the science and there was a lot of preparatory work before this virus even arrived in our population.
And on the monitoring then, beyond the point of people being administered the injections, how tight, how thorough are the checks to make sure that where there is a problem, it is spotted before too much harm is done to the people who receive the jabs?
This is absolutely critical, and we're working with every country in the world on exactly that. Not just the delivery, which is going to be difficult, getting it out to all the sites, ensuring that you get it to the right people, but also that monitoring. That has been critical with every vaccine we've ever used in the human population, and that's why we have so many safe vaccines. And quite often you start with one, but you move to another because it's more appropriate, and you only understand that by careful and thorough monitoring at all times.
I want to get your thoughts on fair and equal distribution of the vaccines as they are developed. We know for the main three, the AstraZeneca, Pfizer and Moderna ones, a majority of the richer countries have already taken up the bulk of that in pre-orders. And that's raised questions about what's going to become of the developing world and many of the poorer countries. Will they be left out and basically have to settle for the scraps that are left behind?
That's a good question and an important one. So again, because we have seen that in past pandemics, such as the flu pandemic, certainly the rich countries ran in and stockpiled, and there wasn't much left for anyone else. So this time, very early on, we put together a mechanism to enable the countries that aren't going to have the financial clout to get the vaccine, to enable them to get it. And this is called the COVAX facility that's run by us, WHO, but also Gavi, which are the group that provide vaccines in many resource-poor countries, to enable that to be possible. And also CEPI, which is a group that look at innovations and look at accelerating development of vaccines. And so we have, through this facility called the COVAX facility, and more than most countries have joined up to that facility that covers 90% of the world's population.
But very
and what will happen
quickly, Dr. Harris, apologies for cutting you off. The issue with COVAX in South Africa, the debate these past few days has been about the fact that at this point countries don't know which vaccine they're going to get.
Well, certainly, again, we have, through the COVAX facility, have made arrangements to work with accelerating the manufacturing, the scaling up of the vaccines, but also to ensure that there will be every country will get vaccines for 3% of their population. Now, which vaccine, that will still be a discussion, but the good thing is that we have so many candidates now coming online that are showing strong efficacy.
WHO spokesperson Dr. Margaret Harris, thank you so much for your time tonight.